Hello and welcome to today's session. In today's session we're taking a look at how you approach your casualty. So we have a casualty that's currently lying on the floor, unresponsive in front of us. From an approach we can see that they're lying on their back. There does not appear to be any obvious major injuries. They're not soaking wet and they haven't come out of the pond from behind us, they haven't drowned. They're not below a cliff where rubble could have fallen on them or that they could have fallen from a height. There's no ladders. So that information is already starting to give me an idea of what to start to look for. I'm sort of going down the route that there's a medical condition. Our approach, we're then carrying out an initial assessment. It doesn't matter if you've got multiple casualties in your room or in this case the garden. You want to do an initial assessment on each of them to decide which one you treat first. That initial assessment that we carry out is danger, response, airway, breathing, circulation, or commonly referred to as Dr. ABC. So as I approach, I'm considering, is there danger to me? We've got the pond behind. Am I kneeling too close to it? So without thinking, I kneel back and fall in. Although it wouldn't be good for me, it'd be quite entertaining for you on the camera. Am I below the cliff? Is there a risk of rubble falling on me? As I knelt down, is there anything on the ground that could have cut me? So I need to be considering that danger. If it's too dangerous for me to approach, I'm calling the emergency services, letting them know the situation and letting them send the resource to deal with that situation and help the casualty safely. Once we know it's safe and I can kneel down next to my casualty, I'm considering, are they responding? So we're going to introduce ourselves as we approach, saying, hi, I'm a first aider. Can you hear me? Can you open your eyes? Can you clasp my hand? When we go unresponsive, we don't just suddenly go out of it, we go through levels. So by asking those questions, I'm finding out how unresponsive they are. So do they respond to my voice? Or is it a case they only respond when I shake their shoulders? Or if I ask them to do something, can they clasp my hand? It helps me understand how unresponsive they are. Once I know a patient is unresponsive, if I'm on my own, I'll give a shout for help, try and get some attention to me. They can go off and call an ambulance once I have the information, allowing me to treat the casualty. Once I know they're unresponsive, I want to think about the airway. Can they easily breathe? Looking at a casualty where they are now, the head is tilted slightly to the side and slightly forward, so they may be struggling to breathe. So I need to think about opening that airway by tilting the head back. Once I know they've got an airway, are they breathing? So we're watching that chest movement. At the moment, due to COVID, we don't go down putting our head near the face because of the risks of passing on the COVID virus. So we're just watching the chest go up and down. The final one, the C, is circulation. If my patient was conscious and talking to me, I'd be identifying that they're breathing, but then also I'd be looking at what's going on with colour in their face to see whether they've got signs of good circulation or whether they're looking very pale, they're looking blue around the lips. Could there be a concern with it? So our initial assessment of all casualties is danger, response, airway, breathing, circulation. I'll now demonstrate to you that in action.
So we walk in, we are checking for danger. We can kneel down, we're checking for response, talking to them, shaking the shoulder and asking them to clasp our fingers. We shout for help to try and get some attention, and then we open the airway by placing the palm of the hand on the forehead, 2 fingers underneath the chin and tipping the head back, which you're watching for breathing by watching the chest move up and down. So if you're currently working from home and having the challenge of entertaining your children while working, why not get a teddy bear and work with them to demonstrate the kids' skills on the teddy and then let them go off and play. Hopefully then the only interruption you'll get is, "Mummy, Daddy, look what I can do." Let's see this in practice. As we approach our casualty, we're checking for danger to ensure we won't be injured as we kneel down. We're checking for response by shaking the shoulders, talking and squeezing the hand. If we're on our own, we shout for help, and we tip the head back, palm of the hand on the forehead, 2 fingers underneath the chin, watching to see if they're breathing with the chest and rising and falling. This is the initial assessment.
So we've looked at how we approach our patient. We're considering the safety, we're considering that danger. As part of the approach, we're looking to see what we notice as we arrive. Are we noticing that there's pools of blood on the floor? Are we noticing that a limb is of a funny shape? What position are they in? Where are we? We're outside. Are they going to get cold? So we're picking up on those things as we approach and as we assess the danger. We then want to check response. We want to think about their airway. We want to think about their breathing, and we want to think about circulation. Once we prioritise which casualties we're going to go to, and we always go to the quietest casualty first because there could be that risk of airway, we contact the emergency services as per our previous session, and we pass on that information. So in the next session, we're going to look at how we manage an airway and how we deal with an unresponsive patient and make it safe for us to get help.